how much does a breast implant surgery cost? Or maybe you want to just know what is the cost of breast implants along with other breast enlargement surgeries. So it is very difficult to give a cost based on a text message. Please remember, as professionals, we need to assess you, we need to assess your needs, we need to assess what is the end goal that you're looking for, and that allows us to decide what is the technique that is going to be used for the breast implant procedure, what is the size of the implant, whether you need cleavage along with it, and whether you need any breast lifting procedure along with it. That basically decides the cost of the procedure. Of course, at this stage, it is possible to give you a rough idea of the cost. Basically, breast implant surgeries start from approximately around 1.5 lakhs, but they can be very different. For example, a dual plane technique is more intricate, and we feel proud that at Divine, we have literally customized the dual plane technique for our Indian patients. Addition of cleavage is an additional procedure. Suppose we are doing any form of a breast lift, it's an additional procedure. Now, you might also require internal bra, which is completely different and customized procedure. So it gets very difficult to give one cost at this stage. We always recommend that you come in for a consultation or at least do a video consultation with our team of plastic surgeons, so that we can make a accurate assessment and give you the potential to get the best possible results at the most optimum price. Now, this is about breast implants. Of course, there are patients who also want to go for breast fat injection. They're not comfortable with breast implants alone. In such situations, breast fat is done. What you need to know is at least two-thirds of the breast fat will disappear within 4 to 6 weeks. So you might need to do it multiple times, 2 times or even 3 times, in order to get a reasonable breast enlargement, and therefore costs keep adding up when you do multiple procedures. In fact, it is strange, but doing 3 breast fat injections may actually be more expensive than doing a breast implant surgery. So it is important that you define your goal. What are you looking for? Lastly, breast fillers can be done. Breast fillers are temporary. If you want a breast enlargement for the next 6 to 8 months, then breast fillers are an option. No surgeries involved, just injections are done. Breast fillers can start, the cost for this can start from 1 lakh plus GST onwards, depending on how high you want to go. Sometimes, once or twice a year, we do special breast implant camps, especially for students and people who come in from more, less blessed backgrounds. These are very rare, maybe once a year we do it, and the prices are very special in those camps. If you want to know more about those camps, you can enroll with my team. However, there is no assurance that that camp will happen in the next 3 months or 6 months, or it might happen even after a year. So please remember that if you find that breast implant surgery is expensive, you have to take a couple of things into consideration. One, the quality of the implant, the quality of the plastic surgeon doing it, the kind of facility that is there, and would you like to compromise on the quality of implant? Do you know that if you choose a cheap Chinese implant, it can actually burst? Now, if that bursts, it can be very threatening. It can be very dangerous. So, by trying to choose a cheaper cost, you might make the mistake of going in with a cheaper implant or a less experienced plastic surgeon, and that could be very, very dangerous for you. If you find that you're not able to afford the breast implant surgery, then please either save money, take 6 months and save money, or do the EMI procedure. You can actually pay over 12 months for that breast implant surgery, and that actually allows you to do the procedure in a very safe and proper scientific manner. Suppose you want to know about breast enlargement and how are the ways that you can do breast enlargement. Let me tell you about this. So, breast enlargement as a whole can be done in multiple ways. The most common is the use of silicone breast implants. 93% of patients globally do silicone breast implants for breast enlargement. This is a procedure which uses this is called a silicone breast implant. It is made of silicone gel covered by a silicone shell. This usually comes with a lifetime warranty, and now currently we have amazing quality implants, and you can sit on them, you can throw them, you can literally drive your car over them, and they don't lose their integrity. That is how powerful a silicone breast implant is. The advantage of this is that you can do a surgery within 20 minutes to 45 minutes, go home after 4 to 5 hours, and actually be in office as soon as the next day. The next most common procedure is fat injection. Fat is taken from multiple areas of the body and injected into the breast. However, 70 to 80% of the fat can get absorbed, and you might need to do multiple procedures over a period of time to achieve a large breast shape. And therefore, it keeps adding to the cost, and also many surgical procedures are needed. So, today, very few patients actually go for breast fat injection because of these factors. Lastly, there is breast fillers. If you want a temporary enlargement, then we use hyaluronic acid body fillers. Can be done within 30 minutes, no anesthesia required. Straight away do and go back to office. The result only lasts for 6 to 8 months. So I'm sure you want to know more about this and what procedure is the most ideal for you. In such a scenario, please let us know and you can connect with us. We would be so happy to have you consult with us and my team so that you get the best solution for your breast problem. Many young patients who want to do breast enhancement surgery ask us this important question: can we breastfeed after breast enlargement? The answer is a big yes. And why is that? Breast implant surgery in the modern era can easily allow you to breastfeed, whether you're a young adult or a middle-aged lady. If you consider a breast enhancement surgery with breast augmentation, with breast implants or fat injection for that matter, you can easily breastfeed, especially if you do the dual plane technique or the subfacial technique, in which we actually almost don't touch the breast at all. We go below the breast and we cause no damage to the breast tissue or the ducts which lead onto the nipple area, and therefore this allows you to comfortably do breastfeeding for your child. So if the only fear you have had for doing a breast enhancement surgery is breastfeeding, then throw that fear out of and do the breast enlargement with 100% conviction that you'll be able to breastfeed. Some patients who have done a lot of research on breast implants ask us that how are the ways that you can do breast enhancement surgery? What are the techniques of doing breast implant surgery? So in this video, I'm going to break difficult techniques or steps of doing breast implant surgery and make it very simple for you to understand. I will also tell you what situations allow which technique of breast implant surgery to be done and who is a candidate for what type of surgery. So, breast implant surgery can be done in 4 or 5 different ways. The implant, this is a silicone breast implant, can be placed into the gland. So, we open the breast, above the muscle, we separate the gland and put the implant in between the muscle and the gland. Secondly, it can be placed subfacial. Subfacial means, so we open the breast, separate the gland along with a layer of fascia above the pectoralis muscle. That fascia is a strong fascia, it covers the breast implant and does not allow it to be felt. So it reduces the palpability. In fact, over a period of time, it even reduces contracture, the capsular contracture rates. This is the technique that is popularly done at Divine. Third, submuscular. Today, I don't recommend submuscular breast implant for everyone. I think it's an old technique and we don't like to do it at all. Fourth, dual plane. The best, the most modern technique of breast implant surgery is the dual plane technique. What is it? In the dual plane technique, as the word suggests, two planes, dual plane. First, we create a plane above the muscle. We move the breast tissue away from the muscle, create a plane according to what type of movement we want to create. So if we want to shift the breast inwards, we can do that. If you want to shift the breast upwards, we can do it. If you want to shift the breast outwards, we can do that as well. Depending on how much of breast movement we want, we start the first step of the procedure. In the second step, we lift off the muscle, put the implant below the muscle, and then cut the muscle here along the edges of the muscle, and that allows the muscle to rise up and cover the implant from the top, gives a great coverage to the breast implant and does not allow the implant to be palpable. The biggest advantages of dual plane surgery is that it helps the breast come inwards, upwards, gives a very high upper pole fullness, creates a cleavage type of an effect. The dual plane takes longer, is a little bit painful for 1 or 2 more days compared to the subfacial plane. So, between subfacial and dual plane, how do you choose? If a patient is very thin with hardly any breast tissue, we do dual plane. If the patient wants the breast implants to come closer, then we do dual plane. If they want upper pole fullness, then we do the dual plane. If they want it for the media, where in certain types of clothing they want the breast to be visible, then we do the dual plane. If a patient has already got a good pair of breast and no sagging at all, then a subfacial is quite good enough. Dual pen also has the advantage that we can lift up the breast by about 1 to 2 centimeters. So mild cases of breast sagging can actually be treated with a dual pen technique. And I'm very sure you want to judge and you want to find out what is the best technique available for you. So you should connect with us, either consult me or you can do a video consult, and then we can assess which technique is the best for you so that you end up getting the best of results of breast enhancement. An interesting scientific question is, what are the approaches to towards a breast implant surgery? So what do I mean by approaches? How do you access the breast? How do you enter the breast? The most common way is the inframammary approach. Infra means below, mammary means breast, so below the breast. So we create an incision just below the breast, then we do whatever technique we want, like the subfacial or the dual plane technique, whatever. We create that plane and put the implant in. The advantage of this technique is this approach is it is the most direct, fastest. You get very good symmetry along with it, and the scar is hidden below the breast and becomes invisible. The second approach is through the areola. Sometimes it can leave a scar mark on the areola, but largely it heals very well. It's especially useful for women who are not married and don't want a scar. The disadvantage, we cannot put very large implants. Earlier, we used to believe that there could be some problem in breastfeeding, but that is not the case. You can easily breastfeed after breast implant through the areola route. The third is the transaxillary or from the underarm region. It's a great approach because there is no scar on the breast, but again, very large implants cannot be done. Secondly, there is a definite chance of some breast asymmetry. One of the breasts may be slightly higher than the other. That is a problem of the transaxillary approach. However, the advantages of no scar is also there. Only disadvantage is that when you lift your hand up and you're wearing sleeveless dresses, then the scar might show a little bit. That could be one of the disadvantages, and rarely there can be some loss of sensation in the inner arm region following a transaxillary breast approach. To find out which is the best approach for you, it is essential, like I've said, to fix up a consult and meet with us. So we tell you what is the best for you. Is there something new in breast implant surgery? Interesting. Uh, there's so much of research happening in breast implants. Technique wise, the dual plane technique is the best thing that is available right now, and I think every plastic surgeon should be aware of what a dual plane technique is, because it gives each patient the ability to move the breast inwards, upwards, and give a higher look, a better upper pole fullness. So technique wise, creation of cleavage is a very new concept only for the past 3 to 4 years, that you can actually put fat around the breast implant to give a cleavagey effect. And in fact, you can use fat around the implant to reduce the palpability of the implant as well. As regards the breast implants per se, there has been some research on making the implant lighter using special material that it gives the volume, but the implant is not as heavy. So, for example, it might give the volume of 350 cc, but it might only weigh around 200 grams. So, it's more comfortable for the patient. And one very interesting that might come up in the field of breast implants is that the structural lattice implant kind of a thing, which means the implant is actually a lattice structure. It gives support inside the breast as an implant, but gradually it dissolves out. So the structure keeps dissolving, and more tissue actually starts being deposited by the body along that structure. Lattice means a structure in that. And as the implant disappears, it is actually replaced by fibrous tissue created by the body. and that basically becomes an auto augmentation, and a few years later the implant will disappear. So there's a lot of work that is happening on this front. I think that could be the future, but there may be certain problems associated with it, like the hardness in the breast or potential of cancer. So we do not know, but at least that is what is happening. There has been a lot of research into cancers related to breast implant surgery, and it has been largely been proved that breast implants do not cause cancers. And if there have been some isolated reports, they have been extremely rare. Does not stop any patient from doing a breast implant surgery. When you're considering a breast implant surgery, a question often comes up: what is better, fat or implant? So, very simple. I think I'll give you my view on this. When you're doing a silicone implant, this is a silicone implant, you get an instant enlargement, a permanent enlargement. The shape that you have in mind, you'll get that. Short procedure, 20 minutes to 45 minutes, discharge within few hours, no pain anywhere else on the body, and the breast size will not come down. On the other hand, a fat injection process requires multiple procedures because 70 to 80% gets absorbed. You have pain in other parts of the body from where fat is taken. It's a longer procedure, and over a period of time, it can actually be more expensive because you're doing anesthesia multiple times. Of course, breast implants leave mark, but we have ways of scar management that we can actually make the scar look so much finer than it actually is. So, my vote always goes to a breast implant because of the better shape, better texture, and actually creating what the patient wants. So, to assess also whether you are a candidate for fat or for silicone breast enlargement, you need to meet with us or do a video consult with us. That is the only way we can actually tell you which is better for you. As a follow up to my previous question, why is fat not recommended in certain scenarios of breast enlargement? The answer is very, very simple. Most of the fat will get absorbed. Now, imagine a situation: you see a large breast initially, and 3 months later, it has shrunk by 80%. I think it will make you very disappointed because for 7 8 days, you're going to have pain in the abdomen or the thighs, wherever we take fat from. You might need to do second or third procedure. That means more anesthesia, more costs, and you do not get a uniform breast enlargement. You might even get fat cysts, which can be very painful, and irregular hardening nodules all over the breast. So, in my view, fat should not be used for breast enlargement, and the best technique that should be done is a silicone breast implant. Can teenagers or young adults opt for silicone breast enhancement or fat injection for breast enlargement? So, how do we tackle this situation? Below the age of 18, we will not do any procedure on you, whether it is silicone implant or fat injection. We are very, very clear on that. Above the age of 18, you can choose to do either silicone or fat. Like I've said, silicone implants are better to, and please refer to the previous questions to understand why. So, a straightforward procedure, which is a short procedure and allows very early return to studies as well as meeting friends. All young adults, if they so desire, can enhance their breast with silicone breast implants. One, because it is safe, it is satisfying, gives you the shape that you want, and it is permanent. So, silicone breast implants are the way to go for enlargement in young adults. What is the minimum age for breast enhancement surgery? I've partly answered that question previously as well. Anyone below the age of 18, we will not take up for breast enhancement surgery. It is mandatory that you should be at least 18 for such a surgery, unless there is a very important reason for this. I had a patient who whose mother called me up saying that she is 17 and a half and is getting modeling assignments, but her photographer has asked her to get a breast implant done because she is relatively flat for the kind of assignments that she's looking for. Possibly in such a scenario, our team will opt to do a breast enhancement surgery. Of course, there are some legalities involved, like notary uh, paperwork, along with affidavits that tell that the patient is actually asking for a breast enhancement, even though the doctor has suggested to wait till the age of 80. So many of you read breast implants need to be changed every 8 years or 5 years or 10 years. So, do you really need to change a breast implant after some time? The answer is no. You do not need to change a breast implant, which actually is a great thing because a breast implant, once it is put in your body, actually stays forever. So, all the major brands which are US FDA or CE marked give you lifetime warranty. They issue you a warranty card, And each of their websites mention that breast implants actually have a lifetime warranty. However, in the European Union, they are mandated by law to write that you are advised to change the breast implant after 10 years. It is not mandatory, it is an advisory, which is basically a legal requirement in the European Union. And therefore, all brand implant manufacturers write this as a legal requirement. However, there have been patients who have had implants in for more than 30 years as well. They're facing absolutely no problem. In fact, we have patient who did her breast implant surgery almost 17 years back, and she's absolutely perfect with no need to change the implant because the breast is soft, it is as it should have been, and therefore we believe that there is absolutely no need to change the implant after 5, 8, or 10 years. Dual plane technique is what you keep hearing our team talk of. So what is the dual plane technique? Let us understand this in proper details. Dual plane, two planes. Now, let us look at the breast. Suppose this is the breast, this is the skin of the breast, the nipple region, the breast tissue, and the muscle. Now, in the dual plane technique, we lift off the breast tissue till the level of the nipple, not the entire breast tissue. Only half of the breast tissue is lifted off till the level of the nipple. Now we can lift off a little bit more if we want the breast to move up. We can lift off more inwards into the breast to move the breast inwards, and we can lift off more on the outer side of the breast to make the breast shift to the outer side. So we have done this as step 1. Then we raise the muscle of the chest. The pectoralis muscle is lifted off. It is cut along the edges. The lower 2 or 3 muscle slips are cut off. It is lifted off the chest, and this muscle actually goes up and sits like this, covers the implant, and allows a better projection to happen. So the muscle actually moves up, covers the implant, gives a better upper pole fullness, and it allows inward shifting of the breast to create a cleavage like effect. The surgery takes about 25 minutes to 1 hour. Patients go home within 5 to 6 hours, and they need a rest for 1 or 2 days, and after which they are absolutely comfortable to start office work. We recommend that gym work, sports, swimming, badminton, etc., should wait for at least 4 weeks after this surgery. So dual plane is the most modern way and currently the best available technique for breast augmentation. Doctor, I think I have breast sagging. Now what do I do? Very common question. So many patients ask us about it. So let's analyze this situation. Many times, these ladies have had deliveries, done breastfeeding, and they tell us they have breast sagging. They actually don't. What they have is loss of volume depletion of the breast, which makes the breast appear to have sagged. How do we know that there is actual sagging or not? Let us see this. Now, if you look at this, suppose a breast is placed like this. The nipple, which is the center of the breast, is here. This is the inframammary fold. If the nipple is above the inframammary fold, it is not sagging, it is deflation. If the nipple is at the inframammary fold, that means it is looking like this downwards, then it is grade 1 of sagging, also called as ptosis, PTOSIS. It's a difficult to pronounce word. This amount of sagging can easily be corrected using ultra high profile silicone implants. Or we can also do a nipple lift kind of a procedure that is easily done. If the nipple is more downwards compared to the inframammary fold, then grade 2 and grade 3 sagging happens, and that requires breast implant along with breast lift surgery. A common mistake that is done by many patients as well as their plastic surgeons is they don't do a breast lift and only put an implant into the sagging breast. Now, what happens? Think of a socks and you put a rock into it. Will the socks go down or will it go up? Obviously, it will go down. And therefore, if you put an implant into a sagging breast, the breast will only sag further and not move upwards. So, to take care of breast sagging, you have to do a breast lift with implant. To take care of volume loss, you only need to do breast implants. How do we actually treat actual breast sagging when a patient comes to us? So, what is breast sagging? As I've defined in my previous question, what is breast sagging? So, breast sagging is defined when the nipple of the breast is below the inframammary fold. So, we do a customized procedure specially designed for you called the dual plane breast lift implant surgery. We first do a dual plane breast implant, then shape the breast around it. We create a lift, and the entire breast is centered around the implant, giving a nice perky look. In fact, you don't even need to wear a bra to support that breast. The breast just stands up like this. We also do a procedure called internal bra sometimes to support the breast implant. We use a mesh or a net to give additional support to the breast if the breast tissue is weak, because this allows, like an internal bra, a bra to support the implant, and that is only done if the tissues are weak and gives much better support to the breast. We should always choose an implant which is not very big. Big implants in breast sagging can cause further sagging, and we do not recommend them. In fact, they don't cause a good aesthetic look as well. So, in summary, the treatment for breast sagging is either a breast lift if the volume is good enough, or if the volume is not good enough, then we do a breast dual plane breast implant surgery along with breast lift. Ting tong, ting tong. I've had pregnancy and breastfeeding. My breast just doesn't look great. Doctor, what can I do? I'm sure this question comes in the mind of so many of you, because all the mothers who have breastfed their child, or in fact had pregnancy, or who have had weight loss, all the bodybuilders have this same question. The breast just does not look great. What do I do? Well, for the first, please visit a plastic surgeon who is experienced in breast surgery. Second, never do a breast implant alone. Never means never do a breast implant alone. You will land up with a highly, even a worse breast shape than what you feel you currently have. So, what is the treatment? Dual plane breast implant surgery along with breast lift. Please refer to some of the answers I've given before in this video to know what is a breast lift surgery. So, if the breast size is adequate and sagged, just do a breast lift surgery. The surgery takes about 2 hours, same day discharge, back to office in 3 days, back to gym in about 3 to 4 weeks. If the volume of the breast is very less, then a dual plane breast implant surgery along with a breast lift will solve the problem for you. This surgery takes about 2 hours to 2 hours 15 minutes. Discharge the same evening, back to office within 2 to 3 days. Exercise and gym can start in about 1 month's time. To understand what might be the best solution for you, we do strongly recommend that you consult us, either physically meeting us or via video, so that you have an idea what could be the best available treatment for you today. What if I'm not so young and I want to do breast enhancement? Is it safe? Can I do it? Do you recommend it? Of course, the answer is a very, very big yes. Suppose you are over 40, 45, or even 50. First scenario is that your breast is very small. Breast enhancement is definitely mandated, warranted in fact. As long as you don't have any medical problem that does not allow surgery, a breast implant can be done. Second, you have some amount of sagging and the sagging is not severe. A breast implant is good enough. Third, you have large breasts, then you need a breast reduction surgery along with lift. Fourth, you have saggy breasts which have lost their volume, and in that scenario, we recommend that you should consider a breast lift augmentation surgery using the dual plane technique. And you will actually, in all these scenarios, if you do the surgery the correct way, you can go to the beach in a two-piece bikini and you possibly never need to wear a bra again in your life. Excited? Happy to hear that? Well, it's not a joke. It is reality. So talk to us, consult us, meet us in order so that we can suggest the best available treatment for you. We've been married for 10 years and now I think your breasts are just not looking good at all. I just don't feel any sort of interest in any relationship. Have you got that comment ever from your partner or your husband? And does it hurt you that a structure, a body part like the breast, can be so important in your life that it can totally determine whether you're happy or sad, or your relationships will be good or bad? A breast which is sad looking needs plastic surgery. Very, very clear. What can we do? What makes a good looking breast deflate or not look so great? Post marriage or pregnancy, the breast can actually undergo deflation. It can become smaller in size. Post pregnancy can get saggy, it can lose volume, it can get bigger in size due to lactation, and overall, the whole shape can change quite a bit. With the use of plastic surgery, breast cosmetic surgery, we can reshape the entire breast, we can lift it up, we can enhance it, we can reduce and lift, we can do a lot, we can create cleavage. And if you have had a bad breast surgery before, we can actually even improve and reshape the things entirely for you. Of course, it's necessary that you consult with a very experienced doctor to make sure that your breasts are made much, much more beautiful than you could ever imagine, and you have a wonderful intimate relationship with your partner. You are a single mother, and possibly your ex has passed away or has left you, divorced you, or you might be married and there's almost no relationship at all. You want to start a second life? Maybe there's one thing which is coming in the way: the shape of your breast. Is that true? Do you know that today it requires just 30 minutes to 2 hours, which is the distance, which is the time required to go from one part of Delhi to another? In that duration of time, you can actually change the shape of your breast forever. Yes. If your breasts are deflated, you can enhance them. If they're saggy, you can lift them. If they are big, you can reduce and lift them. If you have to wear a padded bra to lift them up, you can get rid of the padded bra forever. If you're not wearing a two-piece bikini because your breasts are not fitting well into it, we can change all that. So, don't you think it's time to live your dreams and meet a plastic surgeon to assess what they can help you with? And maybe that can change your life forever. Maybe they can be the reason that your second relationship just, shoots off. It just becomes a beautiful relationship. Does the relationship actually get better? No, it is you who changes. You become a better person, you get more confident, you feel more strength in your mind, and you as a person changes, and then you create a much better second relationship. Young girls with heavy breasts, now what do they do? Now the problem in India is that if you do a full breast reduction surgery, you are left with scars and reduction potential. The potential to breastfeed also comes down. You understand that? And therefore, if you are a young adult with heavy breast, I think it's a very difficult scenario. First, you've had years of mental trauma, years of being teased, not being able to wear great looking clothes. You go to a beautiful clothes fashion shop and you realize, well, that's not for me. And if it's not for you, then you just leave or you go to an XXL store and make do with what you get. You lose interest in sports, you become an introvert. Has this been happening to you? Then I think it's time for change. Two options for you. The first option is breast liposuction. The breast liposuction can take 45 minutes to an hour, and you can go home the same day. It requires about a week of rest at home. You can reduce the fat component of your breast. Of course, the gland component cannot go away, but you can achieve a sizable reduction of your breast size with liposuction. The sagging is not improved with breast liposuction, that you must know. The alternative, which is the better option, is a breast reduction surgery. We reshape the breast with a breast reduction. We lift it up, we make it much more round, give it a nice rounded shape, perky nipples. You don't have to wear a bra to support them anymore. I'm sure you want more information about this, you want to understand this, because now you're seeing that there is a potential to become brighter, better, and live life more fully. So don't wait for anything. It's you who's responsible for your life. And I think it's time to take a decision whether you want to now change the way you've been living and get a better pair of breasts for yourself. Some women, when they breastfeed, they land up with very large breasts. Most of these women already had slightly heavier breasts to begin with. But what do you do now? The biggest problems: can't wear proper clothes, all the issues of pain, neck pain, shoulder pain, back pain, bending downwards, not being able to wear the best quality clothes, best type of clothes. Sometimes women even have infection in the under breast area. So, what do you do? With the advent of good plastic surgery, we now have the surgery called breast reduction. We can reduce the breast, make them smaller, we can lift them up, make them rounder, we can take you from a G cup to a D cup in the space of just 2 hours. And in most women, you can actually get back to office within a week and to active gym work and sports in as less as 4 weeks post procedure. So, this is not going to happen just like that. You have to take the first step and see a plastic surgeon in order to understand what might be the best procedure for you. It is important that you are not a smoker, you are not a frequent user of hookah, because nicotine causes a lot of problems, and you have a good hemoglobin in order to get great healing. There are so many such small tips which can make the difference between a great result and a bad result. I'm sure you want to know some of them. Connect with me, connect with my team. We'll help you get a great result in your breast reduction journey. Does breast surgery lead to scars? Important. It's very, very important. Before I begin to answer this question, let's understand what are the choices that you have. Suppose you have a small breast or a saggy breast or a heavy breast. Can you be happily living like this forever? Can you? Answer that question. Because once you decide that you cannot live like this forever, then you get the answer: okay, what if there are scars? Is the current shape of your breast better, or are scars better? Now, we have ways and means to make the scars minimum. Using good scar treatment, we can reduce the scars, make them finer, make them look better. A breast implant can be done 3 ways: from under the breast, on the nipple, from the underarms. The last technique does not leave any scar on the breast. The first two leave a scar on the breast, but they are barely visible. A breast reduction and a breast lift will give you scars like a lollipop hanging down or like a T. But again, the scars are hidden under the breast. And my interview with women post surgery has led me to believe that women will happily accept scars if they get a beautiful breast shape. Since the scars are not visible on the top, it doesn't stop women from expressing themselves, wearing bikinis, and generally feeling very happy that they transform their lives. So, scars may not be that bad, but the situation you are in is not that good either. Let's reach a compromise between the two. Let's give you great scars and a great breast shape. How does that sound? Is there any way you can avoid scars on your breast for a breast implant surgery? In other words, what are your options if you want to avoid scars and do a breast enlargement surgery? First, do a fat injection. But I don't recommend fat injection because it doesn't give you a great shape at all. It's a compromise. What is the best thing you should do? Is a breast implant surgery. If you don't want any scar on your breast, what do? Very simple. We just go through the underarms, make a small cut here, and push the implant from the underarm region from here like this, and it fits here. Couple of problems: it's difficult to wear sleeveless dresses after that because the scars might be visible, or the bigger problem is sometimes there may be a mismatch. The two breasts might not be at the same level. One may be slightly higher by about, say, 3 to 4 millimeters. But if you're happy with the fact that you don't have a very large breast, because we can't put big breast implants, normal size breasts with good results, a small chance of asymmetry, then I think you can go the transaxillary way without getting scars on your breast. Another way is to put it through the nipple region. The areola, if it is big, we can make a cut and put the implant through that. Leaves a very fine scar. I would not say invisible, but very fine. Saves the scar on the underside. So now you have choices. You have lots and lots of choices to consider what is the best option. If you're unmarried and you want a breast enlargement, what are your options? I think I've answered that a couple of times, but you can do fat injection or you can do breast implants to the underarm region, also called as the transaxillary approach. You can also put it through the areola, as I just explained, and that will also leave you with barely any scar at all. Suppose you have large breast and you don't want scars. What are your options? Well, honestly, very limited. Because if you have large breast, you have to remove fat, you have to remove the gland. If you don't want any scar, the only and only option is to do a vaser liposuction. A vaser liposuction is basically a technique which uses sound energy. It is passed, the instrument is passed from the underarm. You can't see the scar here. And it is the whole breast is worked on, and the vaser basically dissolves all the fat. And then we do a liposuction to take the fat out. The advantage, you lose all the fat component of the breast, but the gland part cannot be removed. And what that means is you're going scarless, but if you've got a very heavy, dense breast, then the gland part is not removed, the fat is. So most women will lose anything from 30 to 60% of the breast size. But the biggest problem here is the breast which is saggy cannot be lifted. Because to lift, you have to cut. There is no option. So if you're happy with slightly, what do I say? Uh, a breast which is deflated and saggy, but at least they are not big, then consider a vasoliposuction for your treatment. The problem of having very large breasts is serious. I have explained previously, women suffer from so much large breast, back pain, shoulder pain, neck pain, sweating issues, fungal infection, wearing big bras to pull up the breast, causing so much pain. What if you want to make them really small? So, in a previous section, you would have come across my answer about doing a breast reduction surgery. So, you already know about it. But there is another option of doing something called a breast amputation. What does breast amputation mean? A breast amputation basically means that suppose the breast, instead of being like this, where it follows the natural breast mount, is more hanging and big. So, what we do is, suppose the breast is really big, the breast on top, which actually forms the normal breast, is kept and rest of the breast tissue is removed. The nipple is removed as well. The new breast is formed by the part of the breast on top of the upper part, which is here. It is removed, or everything here is removed. Stitches are put from here. Large stitch line unfortunately comes, big scars, and the nipple is then stuck onto the top of the new breast with stitches. It loses its function, obviously, no breastfeeding. Sensation is virtually zero, but you do not have those heavy breasts anymore. You get very small, very natural looking breast, but no nipple sensation, no nipple function, and large scars which run from one end of the chest to another. So, if that is what you're looking for, then consider breast amputation, but it is possible that you might do very well with just a breast reduction and not an amputation. And if you want to know whether you're a candidate for which of these procedures, you need to connect with a plastic surgeon who's closest to you so that you can discuss and plan your procedure. Is it possible to get a cleavage along with your breast implant surgery? Well, actually, true. It's a fact that most women do not actually have a cleavage. Most women actually have breasts which look outwards, and they have a myth that if you do a breast implant surgery, you will automatically get a cleavage. Sorry. Sorry to break your heart, but that is not true. What we can do, however, is consider the dual plane technique of breast implant. I've explained that in my previous videos, which allows the breast to actually come inside and create a good cleavage effect. Of course, if the breasts are too wide apart, nothing can be done. They will come in the middle, but not so much. But if the breasts are in an intermediate position, they actually come inside. On top of that, we do some fat injections. And the fat injection allows the silhouette to be created in a way that it appears the breasts are close together. So I'm very sure this is exciting for all those who want a cleavage. If you don't want a cleavage, of course, you don't need to do fat injections. You can just do a dual plane technique. But addition of just a little bit of fat can completely transform the way you look in V-shaped dresses and in those sexy smart evening wear that you really want to wear. For a breast implant surgery, do you really need to bring someone along with you for surgery? Well, it's a tough question to answer. If possible, relative or friend is always good. However, if it's a scenario where you do not know anyone in the city or no one can actually accompany you, as long as you are an adult and your family knows that you're doing this surgery, then I think there is really no need to bring anyone along. We, of course, will need the contact details of your close relatives along with their identification papers, but you can actually come alone. And in most surgeries, we discharge you the same evening. So there's hardly any recovery to it. Couple of days of rest, and you're back to action again. If you're a transgender and you want to do a top surgery for getting a bigger breast, here's what you have to do. First, there are some legal requirements. You have to have one psychiatrist certificate telling that you know what you're doing and you're allowed to do what you're doing. You need to be on estrogen treatment. Then you need to consult a plastic surgeon. Please make sure you go for the proper approved breast implants. Unfortunately, a very large number of patients end up doing the unregistered Chinese and Korean implants, which can be very damaging and dangerous for your body. Your doctor will make an assessment as to the largest possible size of the breast implant that is possible, and then they will put it in a subfacial fashion in order to create a nice, proper look for you. In our experience, the dual plane technique has not worked well in transgender patients, and in fact, it leads to a wide separation of the breast because in men, the breast is very laterally placed, and the dual plane actually pushes it out even further. So, never do a dual plane if you're a transgender, only consider the subfacial approach of breast augmentation. Doctor, your costs are so high. I don't think I can afford you. I'm going to do it with that doctor who's doing it for half the cost. Sadly, I get this a lot. The problem is, are you really helping yourself if you're looking at a much lower cost? The cost may be low, the price you pay may be much higher. Are you sure you're getting a proper registered breast implant? Does it have approvals of either FDA or EU? Is your doctor qualified enough to do these procedures? Do they have that big experience? Are you going to get a good follow up? Is the hospital that you're doing a dedicated plastic surgery hospital, or is it just any hospital where there's a high chance of infection that you might get from, say, a sick patient lying in the next room? Does the hospital that you want to get your surgery in look aesthetic? Do you actually deserve something that is not great? If you have a budget issue, you have the option of doing EMI. Absolutely. You can pay over 12 months, budget yourself, create a fund for your breast implant surgery. But please do not compromise on the quality of either the implant or the doctor. That is not going to help you. So, in order to get the best results, make sure that you choose these three factors correctly: proper implant, good surgeon, a hospital which ensures safety, and a infection free environment. Do breast implants look natural after surgery? 100 and if possibly 101% patients ask for this, and in fact, even doctors want to know that do breast implants actually look natural after surgery? And my answer is a resounding yes. But there are some factors behind it. What? If properly selected, proper measurements, proper size selected, patient characteristics studied, patient aspiration studied, then they look perfectly natural. But dear friends, what is natural? A lady who's in the showbiz, for her, natural is very different from a lady who's a housewife. A lady who's an aerobics instructor, her natural is very different from the natural of a school teacher. A lady who's the aerobic instructor wants larger breasts because she wants to look more fit with the appearance of a slimmer abdomen. However, the teacher does not want any unnecessary attention. So, what is natural? What I'm trying to say is that who defines natural? Do doctors define natural or do patients define natural? This experience I've had over these years, I believe that it is the patients who decide what is natural for them. I recently had a patient who did not want a very big breast, and as per her measurements, as per the surgery, the skin stretch, I chose to do a 350 cc implant and it fitted perfectly well. In fact, in the post op pictures, her side profiles looked beautiful. I mean, absolutely wonderful. However, for her, she felt it was too big. And 10 days after the procedure, we downsized her to a 280 cc implant, and she's been so happy after that. Even though 350 looked absolutely natural for her. So please remember, it is you who decides what is natural, but it is very important that you pass on that communication to the doctor. We have to know what is there in your mind, because if I don't know that you are in the showbiz and I treat you like a housewife, then the relationship will break, because what you wanted I could not give, even though I could have if I knew it correctly. So, having said that, breast implants can be made to look natural as well as unnatural. The same base diameter can fit 300, it can also fit 350, it can also fit 385. We just need to dissect a bit more, create more space. And a smaller person, a larger implant looks unnatural. A larger patient, even a larger implant looks very unnatural. A patient who has a tight skin and ultra high profile look will look very, very unnatural. A patient who has loose skin, a moderate profile will look very unnatural. So, breast implant selection is not easy, and it is important that large amount of experience is involved in proper selection of the breast implant. But selection of the technique, dual plane looks way more sensual than a subfacial. It adds more sexiness to the result. Is that natural? Again, the patient defines it. So, selection of technique, selection of an implant, type of implant, ergonomics, round teardrop, etc., etc. Clothing, everything decides what is natural. But we firmly believe that once we interact with the patient and discuss in great details her psychology, her job, her aim, what is she wanting to do this for, what does the partner or the boyfriend think, what does the husband want, what is she modeling, is she a teacher, is she an aerobics instructor, what is her future goal, is she going to get pregnant, is there a potential for weight loss? All these factors need to be taken into account before deciding what is natural. But yes, breast implants can give absolutely natural looks. If I cannot afford the cost of a breast implant surgery, can I still do breast enlargement? Yes, you can. You can choose to do fat injection, but know that you might need multiple sessions. Alternatively, the way to go about it is, please budget some money. Save some money over the next 3 months, 6 months. Breast implants are not shutting down. The companies are very much there. We are going to be operating for few decades. You must save some money and do the best quality implant with the best possible doctor, because once it is in your body, it is there forever. The third thing you can do is, you can take EMI from a large number of these companies today are providing medical loans where you can pay over 6 months, 12 months, or even 24 months. And the EMI, the amount of money that you have to give to the bank every month is very less. So it is quite affordable for most patients. So think of that before making the wrong choice of choosing a very cheap surgeon, because you might just land up with Chinese implants. What are ergonomic implants? Ergonomics is a type of an implant which is marketed by one particular company, which has received its USFDA approval. I do not have any financial disclaimer here, but ergonomics has a unique potential. It is the closest to a teardrop shape without actually being teardrop. So if you hold it flat, it looks like a round implant, and if you make it stand up, it looks like a teardrop, the silicone drops. So they have made it in a way that the shell is weaker at certain parts so that the silicone is able to shift down. Now, teardrops are the most natural form of breast implants, but today getting a teardrop is more and more difficult. So the next best is ergonomics. Unfortunately, it is very expensive, much, much more expensive than round implants. And the inventory availability in India is much lesser, with average wait times of 6 weeks to 12 weeks to order a breast implant. So if you can afford and you have the time to wait for an ergonomics implant, I think that's the way to go for your breast implant surgery. If you're not from Delhi, how do you get your breast implant surgery or a breast enlargement surgery with us at Divine? It's a great question. Can we do something to help you get the best possible results using our experience? Yes. I'll tell you how. For patients who are outstation, we make special arrangements and make a package which includes your travel. We pick you up from the airport, you do your surgery with us, you stay with us for 1 or 2 days, we drop you back to the airport, and you can straight away fly and go back home. All this is included as a package, and you get all the experience of our wonderful team, our wonderful hospitality, and the best of skills. Suppose you cannot travel for some reason or the other. In that scenario, our team of doctors travels to all the major cities in the country, and they can operate you there. However, the cost of the procedures do go up a little bit because outside Delhi, we do not have our own hospital, and hospital charges add up a little bit. So if you are sure that you will get the best treatment at Divine, then Divine will make sure they offer their services to you. So if you're in Hyderabad, Bangalore, Bombay, Calcutta, Ranchi, Jaipur, let us know. We will come to you in your city to make sure you get the best results. What is the recovery after a breast enlargement procedure, and when can you go back to gym, when can you have sexual activity, when can you get back to office? I'm going to answer all these in the next couple of minutes to make sure that you understand the recovery is smooth. Once you do your breast implant surgery, you can actually go home after 5 to 6 hours. We routinely get patients who fly in from abroad. We had a patient who came in day before yesterday night for a breast implant surgery. She did her surgery in the morning, and in the evening she flew back to Dubai. Dubai is not in India, so you can understand the implications. So patients actually get back home the same day, rest for a day, maybe two at most, and then get back to office. So routine office work, typing, writing, overseeing stuff, law, medicine can all start by the second day. Gym activity, exercises can start by 3 weeks unless you've had a dual plane where we would want you to wait for about 4 weeks or so. And that also starts slowly. So office I've discussed. When can you get back to gym? I've discussed. When can you get back to sexual activity? Very, very important question, especially for today's generation. You can start with gentle sexual activity as soon as 10 to 12 days and get back to your natural activity mode by about 4 weeks of time. Another important question that is always asked is, when can you sleep on your bust? When can you turn around and sleep on your abdomen? So you can sleep on the sides even from the second or the third day onwards, and you can only turn onto your bust when the stitches have healed up so that there is no trauma to the stitches, and that could be about 3 weeks or so. At 3 weeks, you need to send us pictures or come and get yourself examined. We will assess you to make sure the stitches are fine, and then you can actually sleep on your tummy, and nothing wrong will happen. So I hope that has answered your questions about recovery. I'm sure there would be some more questions, and it will be a pleasure to connect with you and help you solve all these questions as well.